He said 10 o'clock. He left an audio message in the Lions group. Very nice. I think all you guys are really doing very nice.
Did you try that selfie? That is excellent, actually.
I tried, but I'm not able to. I don't know. There's some issue, I guess.
But that is a very good use of technology, I must say.
Yeah, true. I think virtual conferences now are having these, like in APAC as well. They have
just as good as physical conferences. Maybe sometimes we feel that they are even better.
Yeah. It's like, I'm vaccinated. That's how it came in.
So, yeah. So we are all vaccinated for this conference.
True.
Thank you, sir. So I request all the chairs and speakers to please mute yourself for next 2 minutes. So we are simultaneously live streaming on YouTube as well as the conference portals. So we are going to start now. Good afternoon. Welcome you all for the symposium session on Galvanizing Youth for Tobacco Control. Youth engagement and involvement is pertaining to tobacco control. However, young people in the country are exposed to harmful use of tobacco. As per the latest tobacco atlas, more than 6 lakh children use tobacco either in smoking or smokeless form. So therefore, it is important to build the capacity of young people to catalyze changes and support effective tobacco control measures in the country. The symposium will sensitize the tobacco control workforce on importance of reducing tobacco uses among the youth. So it's our privilege to have our chairs today for this session. So we have with us our first chairs. With us, Mr. Narendra Kumar, Principal Consultant, Policy and Campaign for Tobacco-Free Kids, CTFK. His work include a variety of activity pertaining to tobacco control. However, the core of these activity remain the policy engagement, policy making changes and implementation at national level and sub-national levels. So these include building the broad support among political bureaucratic leadership for tobacco control and its effective implementation at different level of policy making and enforcement. So advocating for empower plus policy like regulations of retail tobacco selling through vendor licensing, linking subnational advocacy efforts and spread over different provisions to national advocacy effort to CTFK, in particular involving an issue of tobacco tax and tobacco industry accountability. So welcome you, sir. I request Mr. Narendra sir to give the welcome remarks to the audience.
Narendraji, you are muted. You are muted.
Thanks, Rajiv. Greetings and good afternoon. It's a great honor to be part of this symposium. As Rajiv said, youth indeed are one of the most important, let's say, stakeholders in tobacco control. They are both, as they call, factors and actors in tobacco control. I mean, when industry plans its strategies, including their media strategies, business strategy, promotion, etc., they always keep in mind what would be the youth's preference, what would youth like. So this means that all the activities that, or let's say the most of the activities that the industry conceives and implements, they centers around youth. So that is why they are the main factor. And by the same logic, they are also the key actors. And unless I think they control, they take control of our tobacco control activities, it would be sort of not fully, let's say, implemented, and there will always remain aspirational gaps. The good news, however, is that youth itself is now aware of these challenges, and they recognize their role and centrality of their role in tobacco control. And well, to deliberate this, we have a great sort of list of speakers today in this symposium, and I look forward to a great discussion. Thank you, Rajiv.
Thank you, sir, for giving the welcome remarks. So we have with us our second chair of the day, Ms. Upinder Preet Kaur Gill, Director Program, Generation Savior Association, and working in the field of tobacco control since 1996. So ma'am is elected municipal councillor, founder and author of Stories and Smoke and Life. She did the BCom honors from Punjab University and postgraduate in MBA Finance from Weekly University from USA. She founded a community social action group, Girls Rise for Mohali, which aimed to establish a just society for all genders and coexist in harmony. So I request ma'am to share the welcome note for the audience and then move to next. Yeah, request you, ma'am.
For that very elaborated introduction, and I congratulate PGI for this amazing conference that has been hosted, and also I welcome all the co-chairs. I'm really honored to be a part of this session, and as Mr. Narendra also said that youth plays a very vital role when we talk about any public health program which involves behavioral change, which involves community participation, because as it is very rightly said that we cannot always be it must not always be possible to build the future of our youth, but we can always build our youth for the future. So I think that's exactly how all the different stakeholders in the country at the national level, at the world level, are working to engage youth to achieve a common objective, a common goal of eradication of this tobacco menace that has been there in our society from a very long time. And this session, I've been going through the agenda and I've been going through the other sessions that are happening in this conference. I think there will be a lot that the youth of today are going to learn from this session, and also we as advocates and workers in tobacco can we do the youth to, or it's going to be a fruitful one. And without taking more time, I think we should move ahead and take forward the session. Thank you, Rajiv. Thank you once again.
Thank you, ma'am. So the third chair of the day is Dr. Rakesh Gupta, President and Director of Public Health Strategic Institute for Public Health Education and Research. So, sir have a professionally experience of about 36 years in Punjab government as a PCMS officer, more than 10 years of expertise in managing and actively contributing in national non-communicable disease program, especially blindness control and tobacco control program. Sir also alumni of Johns Hopkins School of Public Health, Baltimore 2012, and University of California, San Francisco 2012 as a short-term scholar. So sir is a former Director Health Services and Chief Chemical Examiner Department of Home Affairs and Justice, Punjab. So I request you, sir, to give the welcome note, welcome remarks.
Yeah, thank you, Rajiv, for the generous introduction. And actually, Narendra ji and Upinder ji, they have already introduced all to the topic. So there's no doubt that we need to galvanize youth for tobacco control. It is important to tell them about the harmful facts, and they must be introduced about the anti-tobacco laws and the toffee guidelines. They need to be activated. I mean, all schools, education institutes, they must follow these. So I think we can start with the session, Rajiv.
Thank you, sir. So now I request our chair, Mr. Narendra, sir, for introducing our first speaker. Over to you, sir.
It's a great privilege to introduce Dr. Poonam Khattar, who is the first speaker. She specializes in health promotion, tobacco control, training, technology, and gender. She has also been responsible for the development and launch of the course on health promotion through distance learning and is the coordinator of the same at NIHFW. Dr. Khattar has undertaken various assignments in collaboration with WHO and Ministry of Health and Family Welfare, and is the member of various committees. I welcome you, Dr. Poonam Khattar. So over to you, ma'am. Ma'am, the session is over to you, Dr. Khattar. You are on mute, ma'am.
Yes, welcome everyone, and thank you so much for this privileged invitation. And I think we have the presentation with the audience. They are going to start it, please. Tobacco control. Health effects of tobacco. Next slide, please. This is one of the opening topic or a session in educational or training activities related to tobacco control. Usually, we discuss by having a picture of a human body, and the health effects are commonly discussed under the subtopics of smoking, secondhand smoke, smokeless tobacco, and now emerging tobacco products. A cause of concern with so many serious health effects on the users, it remains a leading preventable cause of disease and death. So, discussing the health effects of smoking, we all know that tobacco has an adverse effect on nearly every organ of the body. It poses various levels of health risks to the users. The physical and mental health of not only the individuals are compromised, but it has far-reaching consequences on the families with regards to social and economic aspects as well. Smoking is synonymous with illness, disease, and death. GATS 2016-17 revealed that about 92.4% of adults believed that smoking is injurious to health and causes serious illnesses. Yet, in India, it's a great challenge to prevent a large number of people from this leading cause of premature preventable death. So let's reaffirm the health effects of second-hand and third-hand smoke. The more second-hand smoke one breathes, the higher the levels of harmful chemicals in the body of a non-smoker. Second-hand smoke poses risk to infants, children, as toxins enter through their sensitive skin and affects their developing brain and other organs. As per GYTS4, about 70% students thought other people's tobacco smoking is harmful to them. Another 59% mentioned to improve health as a reason to quit. The non-smokers who breathe secondhand smoke at home or at workplace increase the risk of developing heart disease by about 25 to 30%. And we know the third-hand smoke affects the health of people by using the cars, the hotels, the rooms which have been used by the long-term smokers. And we know that the residual of the smoke and the particles remain for long on the furniture, fabric, curtains, even after the exposure to tobacco smoke has gone away. So I think we need to redetermine the optimal ways to encourage non-users and tobacco users to seek information related to health effects of tobacco use. This could help in tobacco control initiatives and encouraging smokers as well as users to seek health information for quitting. So, communicating about smokeless and tobacco health effects, we know that the smokeless tobacco products are regarded as gateway drug. They contain nicotine, highly addictive in nature, and addition of lime enhances the addictive nature and hence more detrimental health effects. People using smokeless tobacco are more likely to become cigarette smokers, especially the adolescent and the young people. Beyond the health effects, heart diseases, cancers of oral, mouth, esophagus, larynx, stomach, pancreas, they pose tremendous economic burden on the individual as well as the health. So we know the above are the long established health effects of tobacco use. But what do we do about these? The challenges still remain. The health promotion programs worldwide have long been premised on the idea that providing knowledge about causes of ill health and choices available will go a long way towards promoting a change in individual behavior and towards more beneficial health-seeking behavior. However, there is also a growing recognition that providing education and knowledge itself at individual level is not sufficient. We need to promote a change in behavior, especially in the context of tobacco use, by using the health information. And we know that seeking health information is very important as it predicting attempts towards experimentation, initiation, and to quit smoking as well. So I think we need to determine optimal ways to encourage the non-users and tobacco users to seek information related to health effects of the tobacco use. This could help in tobacco control initiatives, including encouraging smokers and tobacco users to seek health information for not starting and for quitting as. So coming to communicating the health hazards, we need to design the health communication strategies with focused aim to change the knowledge, attitudes, and our behaviors so as to increase the risk perception associated with health effects. Studies are available which show that people understand specific risk of tobacco use. However, when the smokers become aware of the dangers of tobacco use, most of them want to quit. And there are studies which have demonstrated that school children with increased awareness of smoking effects on oral health were less likely to smoke. Thus, educating the students about the health effects of tobacco use, which includes complications on smoking on oral health, should also be an integral part of the curriculum and all educational programs. It's important to discuss the health hazards during the smoking cessation programs and policies as well. Next, please. So coming to the Article 12 of the FCTC, India has made available dedicated funds for tobacco control, public awareness campaigns at national and state level as well. There are studies available which have demonstrated that low awareness regarding the adverse effects of tobacco belonging to the lowest wealth quintile. As awareness contributes to a more considerable extent to behavior modification and adoption of healthy lifestyle, the health effects of tobacco use need to be studied in the context of socioeconomic and regional variations to get a clear perspective on this aspect. In this regard, we need to explore what factors would influence the motivation and health-seeking behavior and ensure compliance for no tobacco use among the children and the youth. Next. So redefining the role of IEC and media is very important. So the media and communication experts can conduct segmentation, audience segmentation, and analysis to explore how to make an inroad given the diverse patterns of tobacco use and socio-economic and cultural disparities in India. The IEC, the Social Behavior Communication Change campaigns, should focus on health effects with innovative media strategies. Can we consider inclusion of young girls or women in health messages as a powerful tool for IEC regarding communicating the hazards? Our media communication channels are evolving at a dynamic speed, and the Article 13, tobacco advertising, promotion, sponsorship, to regulate depiction of tobacco products or their use in films and television. We have to move beyond just notifying a statutory warning about the health effects while airing the smoking scenes in the films. We need to seriously consider taking action to identify gaps and conduct research to gauge the implementation of tobacco-free films. This calls for an education and training of diverse stakeholders by the state and national tobacco control cells, focusing on health hazards and awareness generation activities. A range of professionals need to be trained, from health, education, elected leaders, agriculture, for their capacity building. So let's take this opportunity to galvanize our youth in program and policy planning and implementation and awareness about the health hazards of tobacco use. Thank you so much.
Thank you, ma'am. So I request now our next chair, Ms. Upender Preet Kaur, ma'am, to introduce our next speaker.
I think that was a very insightful start to the session of understanding how tobacco is harmful and what all we really need to explore in making this, the involvement of youth really into it. So with great pleasure, I would request our next speaker, Dr. Amit Yadav. He has worked as a postdoctoral scholar at the Center for Tobacco Control Research and Education at the University of California, USA. He has also worked with Hriday, PHFI, WHO, ICMR, WHO FCTC Global Knowledge Hub on smokeless tobacco. He was also an elected member of the Board of Directors of the Framework Convention Alliance, representing the Southeast Asian region organizations for 2016 and 19. He worked in the public field as a public health, worked in the field of public health law, policy and research, and published several peer-reviewed papers, books, chapters, reports, and monograph on tobacco control. He has also authored a book on public health, tobacco, and trade in India. So I think no one better than him to take us through what our country has in form of legislation to involve our youth into the tobacco control program. So over to you, Dr. Amit. Really look forward to having an insight of your thoughts about the session.
Hello, everyone, and I'm going to present now about very briefly about the Cigarettes and Other Tobacco Products Act and other legislations which are relevant to tobacco control. And when do we got COTPA? We got it in 2003 as a comprehensive tobacco control legislation. This law has key provisions on smoking ban in public places, ban on advertising, no sale to minors, no sale around educational institutions, and on pictorial health warnings. This was after the 1975 legislation, and the first key provision from the COTPA is smoke-free public places, and the section 4 very clearly says that no person shall smoke in any public place. Comprehensive regulations on this were introduced in May 2008, and they came into force from 2nd October 2008. So every public place that is there, the rules require that they should have this board at every place. They should be in the local language, and if in the space you are. So if it is in Assam, it should be in Assamese, and in Tamil Nadu, it should be in Tamil. So that language should be used. And these need to be at every entrance, floor, staircase, and at other conspicuous places where these can be put. However, the law leaves, in terms of an anomaly, and allows hotel with 30 rooms or more and restaurants with seating capacity of 30 or more and airports to have a smoking area or a space. These should be clearly marked spaces, and there is no other activity which is allowed there. You can't serve food and all, and this is exclusively just for smoking. Section 5 of COTPA, Section 5 prohibits tobacco advertising, promotion, and sponsorships, completely bans it, any kind of direct and indirect advertising. However, on-pack, in-pack, and point-of-sale advertisings are allowed with certain restrictions. Surrogate advertising is a very common thing, and the brand stretching and brand sharing continues, which I will show in my subsequent slides. Another provision on cross-border advertising is missing in the law, which needs to be catered at some point of time. So these are some of the violations. So point of sale, which is prohibited, and you see that this is how the point of sale looks like, and which are violations. As I know, this is also again surrogate advertising violations. You can see that once we could see in the market Vimal Gutka, now that is removed and sold as V1, whereas you have Vimal Pan Masala and also Vimal Ilaichi. So these diversification by the industry and brand sharing across different product is part of surrogate advertising and defeats the purpose of the law. Going beyond, even display ban in the movies, it is a prominent provision, and it's one of the unique provisions in the country where all movies having tobacco scene, they need to comply with certain regulations, and which is they need to have disclaimer of 20 seconds in the beginning, and they should have a beginning and middle, and then they have to have health spots at the beginning and middle of 30 seconds, and whenever there is a tobacco use seen on the screen, then they should have this text warning, static message, which should say tobacco kills or tobacco causes cancer. We see that it is not complied completely. There have been evaluation reports that suggest that these are not complied fully. However, this is a progressive provision from the law. Going forward, we see to protect the minors, COTPA provides that no one could sell tobacco to a person below the age of 18 years. This board 60/45 should be at all tobacco vendors' space to let people know that it is prohibited to sell tobacco to a minor. There should be these clear indicators. No sale to minors, no sale by vending machine. And if anyone comes as a minor to buy tobacco, one should ask for identity card with an age proof. And even selling by minors is also prohibited, which is, if you can see the violation pictures there, that it happens. Section 7 provides for pictorial health warning. They started with a 40% front panel warning in 2008, which came into being from 31st May 2009. But from April 2016, we have 85% pictorial health warning, both front and back. So it's a huge leap, and we are among the top countries with the highest coverage of pictorial health warning on all tobacco product packages. Now, what are the penalties for violation of these 4 provisions? For section 4 and 6, it is on the spot fine of up to 200 rupees. For violation of section 4, the person in charge who is responsible for implementation can be challaned for as many violations happening on his premises. So if 3-4 persons are smoking, then the owner or manager of that space or restaurant, he could be charged up to 800 rupees or up to 1,000 rupees as many people are smoking at that public place. For section 5, for first conviction, it is 2 years jail and 1,000 rupees fine, and for subsequent, it's 5 years jail and 5,000 fine. For section 7, producers or manufacturers, they have a higher penalties: 2 years jail, 5,000 fine, and for subsequent 5 years jail and up to 10,000 fine. Sellers and distributor, it is little lesser, 1 year's jail and up to 1,000 fine, and subsequent conviction, it's 2 years jail and up to 3,000 fine. Authorized officers to implement these provisions. There are 21 categories of officials for compliance with Section 4. So all of these 21 categories are authorized to implement Section 4 provisions. For Section 5 and 7, the officials from Custom and Central Excise, Sales Tax, Health, Transport, Labor Department, Industry Department, and Inspector of Police, and Food and Drug Administration. So anyone above the rank of sub-inspector could enforce the Section 5 and 7. They need to file complaint before the designated courts, and the court takes cognizance, and then only the action initiates in Section 5 and 7. For Section 6, the authorized officers start from the principal, headmaster in charge, or vice chancellor for educational institutions, and then going on to all other officials responsible to implement around that space, including the education inspectors and block extension educators, health department and police department, and all are they could implement these provisions. Going beyond COTPA, some of the other legislation. So Smokeless Tobacco Ban is somewhat under the Food Safety and Standard Act 2006. The law very clearly says that tobacco and nicotine should not be used as an ingredient in any food products. So any food item must not contain tobacco or nicotine. So products, no flavorings or like scented supadi or fragrance or any long ilaichi, all of these products, kesar. So they cannot be mixed with tobacco or nicotine. And keeping with that, several states have banned pan masala and Gupta. Even Punjab, they ban nicotine. Maharashtra banned pan masala and supadi. Jharkhand and Bihar have also banned pan masala, containing nicotine or containing magnesium carbonate. So this is a compliance. Even Supreme Court has directed for its compliance to all the stakeholders who are responsible. The Food Safety Authority has written to all the state food commissioners to comply with these provisions. Going forward, even electronic cigarettes and heat-not-burn products are banned in India completely. Their production, manufacture, import, export, transport, sale, distribution, storage, and advertisement, whether online or offline, and it is prohibited in all forms, and it is harmful for health. It is, the nicotine damages the brain. Already we said that nicotine is banned almost all, several states. Also part of the Poisons Act and in Karnataka and Punjab, and so in electronic cigarettes also we find nicotine, and it is prohibited since 2019. Honorable Prime Minister made that announcement in the UN high-level meeting on universal health coverage, and saying that India is proud of banning these products to prevent minors from taking up these addiction. Last but one, Juvenile Justice Act 2015. This is a very strong provisions which only India has. If anyone gives or causes to be given, which means if you are giving or you are you are creating a situation where a minor gets to tobacco, आप देते हैं या उसको लेने के लिए भेजते हैं या मंगाते हैं, एक सिचुएशन क्रिएट करें जहां बच्चे के हाथ में टोबैको आती है, then you are violating the provisions of Juvenile Justice Act 2005, and the punishment is very high. It is regulation imprisonment of up to 7 years and a fine of up to 1 lakh rupees. The Government of India, the Health Ministry, has proposed an amendment to the COTPA Section 6, making these two provisions similar, so that you cannot sell tobacco to to minors, and also the punishment is equivalent when you are selling. Last slide. This is Consumer Protection Act 2019. When you are when somebody is there, then it is important that any product that is being sold, it is sold within the permissions or within the purview of the law. If someone is selling any product outside the legal provisions, then you have a case under Consumer Protection Act. And if you are, if any of the product is being sold without health warning, or any product is sold to a minor, any product is sold, any food item is sold with tobacco, or tobacco with food item. So that is a violation of that particular law of the land. And that's where the consumer can file a complaint to the consumer forum, saying that my right under those laws have been violated, and the product that I got was against the law. And you can file a consumer petition, and group petitions, let's say from Teachers Association, from Youth and Students Association, Consumer Rights Group, can lie before the consumer forum saying that these laws are violated and these products are being made available to the minors and wrongly made available to adults. So these are some of the provisions and brief provisions of tobacco control. And if there are any questions on this, I'm happy to take those at the end of the session. Thank you so much.
Thank you, sir, for giving this very informative presentation and introducing the CODPA and other legislations with our audience. So before moving to the next session, so I request our audience, please put your query in QA session, so that during the open discussions at the end, we will take your questions. So now I request our chair, Dr. Rakesh Gupta, sir, to introduce our next speaker. Over to you, sir.
Yeah, thank you, Raji. And it is my proud privilege to introduce Dr. Swasti. He is very well known in the tobacco control circles, so I don't think much introduction is required, but it is customary to introduce. So Dr. L. Swasti is currently the Additional Deputy Director General and the Director Emergency Medical Relief in the DGHS Ministry of Health and Family Welfare. And he is MD in Community Medicine and MPH from New Zealand. He's also a WHO Fellow in Health Impact Assessment at Liverpool University. And he was in Johns Hopkins School of Public Health, Baltimore, for the leadership program, and in the Public Health Leaders Program at Emory University, US. His major areas of work are National Tobacco Control Program, National Oral Health Program, Emergency Medical Relief, Pre-Hospital Care, and recently he has even introduced those guidelines, the post-COVID guidelines pertaining to all other specialties like cardiology, pulmonology, gastroenterology, etc. So over to Raji. So I think we have a recorded
briefly on the strategies for prevention and control, a brief of the introduction, and what are these tobacco-free educational institutions, the roles and responsibilities of the identified people, and how do we monitor implementation of the TOFI guidelines, and also the current status, little bit of it, and then we conclude the presentation. We all know that we have several strategies for prevention and control of National Tobacco Control Program. It starts from the WHO's Framework Convention on Tobacco Control and the Empower strategy. And in order to implement both of these, we do have what is known as Cigarette and Other Tobacco Products Act and a dedicated National Tobacco Control Program, which we have been implementing from 2007 onwards and gradually scaling up with the main objectives of increasing awareness about the ills of tobacco so that people do not initiate, and at the same time also encourage people to quit for those people who have unfortunately started using tobacco a long time ago, and effective implementation of the Cigarette and Other Tobacco Products Act. And out of these strategies, one which we have newly added about 2 years ago is the tobacco-free educational institutions. This is not something de novo, it is something which is part of the National Tobacco Control Program. We all know the burden of global adult tobacco survey, the second round, which has indicated, and while we are still planning to do the third round, the second GATS survey has already indicated what is the extent of tobacco use in the country. So with this in the background, we also know that the Global Youth Tobacco Survey GYTS4 has also indicated the burden is still high ranging to about 8.5% of the students in India in the age group 13 to 15 years using some form of tobacco or the other. So the focus clearly is on youth, 5,500 children initiating tobacco daily, and 2 crore children of the age group 10 to 14 is also addicted. And we also know that the tobacco industry, for obvious reasons, they target the youth. So 13.5 lakh people die every year. So if they continue to die for many years, the customer base of the tobacco industry is going to decrease day by day. And because of that, to find a new customers, they target the tobacco industry worldwide, have this mechanism of targeting the youth. So 90% of the tobacco users started before the age of 21 years, and while the quit rate in India is still less than 5%. So we have more of people being addicted and less of people whom we have managed to encourage and help them to quit. So the TOFI guidelines, the guidelines for tobacco-free schools or educational institutions, we released in 2009, and we had to revise this again in the tobacco-free educational institution again. And this was based on the GATS2 data and the GYTS data, and hence we had to focus our attention to the schools with the objective of providing a fresh momentum to the implementation of the tobacco control initiatives amongst the adolescents and the young adults. And these guidelines were also to be implemented by any of the institutions, and we will be targeting maximum educational institutions in the country. The implementation of these guidelines, therefore, should result in increasing the awareness about harmful and the long-term effects of tobacco on health, and also awareness about the various avenues available for tobacco cessation, and also to emphasize on the healthy and tobacco-free environment in these institutions, making them finally tobacco-free, and also better implementation of the legal provisions for example, the sale and use of tobacco products, especially those related to educational institutions like statutory warnings and minors, etc. Now, this initiative for the youth has focused both on the demand and the supply side, as indicated by the FCTC articles, and also protects the youth safe campus, and also warns about the signages and through the signages and the posters, and enforce the tobacco advertising, promotion, and sales ban in these institutions, and also restrict use inside and outside the campus. And students need to participate and take ownership. So how do we do this? It's all about these guidelines. So the first thing the educational institution needs to do is, we have a display which is there which indicates the tobacco-free educational institution, signage in the premises of the EI, and also tobacco-free area signage outside. The signage could be in the form of boards or in the form of wall paints and the language of the education institution, and also in the local language. Say, for example, if it's in Tamil Nadu, it should be in Tamil. Additionally, we should have the name and the designation and the phone number of the tobacco monitors, so appointed by the authorities of the system. So now, the best part of this tobacco educational TOFI guidelines is we have a scorecard. If you see the score from 1 to 9, we have got some scores which are 1, 2, 3, 1 to 3, which is like tobacco-free area signage, tobacco-free educational signage, having at the entrance and the boundary, and also the name and designation, contact numbers, and no evidence of tobacco product inside the premises. So these are very doable, very easy, and it goes without much, hindrance from restriction or hindrance from opposition by anybody. And it can be easily done. So these are the mandatory 10 pointers. And we have got those indicators like the posters or awareness material on the harms of tobacco displayed in the premises, and also organization of at least one tobacco control activity during the last 6 months, which is also not very difficult, and designation of tobacco monitors, and their names and designation and contact numbers are mentioned on the signages. So you get another 9 points here each for each of these, and also inclusion of no tobacco use norm in the the code of conduct guidelines of that particular school. So these are also very relatively easy to do and very easily implemented. And then if you go to the next, marking of 100 yards from the outer limit of the boundary wall. This is little beyond the wall, so you have to have a yellow line campaign or a blue line campaign or a red light line campaign at the 100 yards from the outer limit of the boundary, which is as per the CODPA. If you do this may be a little difficult compared to the others. You get another 7 points. And no shops selling tobacco products within 100 yards of the educational institute, which may be compared to the others, the toughest, the most difficult criteria, but not impossible. You get another 7, and a total of this all comprises about the total score of hundreds. So our aim is to score more than 90 or above, and then if a particular institution or a school gets 90 or above, then we declare that school as a tobacco-free school. Okay, now coming back to the same mandatory form of 10, 9, and 7, we also have the item 1 to 3, as I already said, are mandatory as per the CODPA. Number 4 is a poster. And again, if you go to the same group of 3 groups, if you see list number 5, the number 5, organization of at least 1 tobacco control activity. This is also 2 activities in which participate, and a list is also provided. What are those kind of suggested activities? And also a new can be added by the school themselves. And number 6 is tobacco monitor, at least 1 teacher or staff and a champion who will take trophy happen. If we do not have somebody who is responsible for it becomes everybody's business. And when it's everybody's business, nobody usually does it. So we have to identify 1 person here that this is to ensure monitoring of that. And number 7 could be a pledge by the principal of the institute to make it tobacco-free and as per the tobacco-free norms. And yellow line, as I already said, at 100 years. So now in order to implement these 3 of them, the last one is, as I said, the criteria. Number 9, no shops selling tobacco within 100 years. How do we usually do this? The report based on the scorecard can be collected by this is a system under the education department. So the institutional head, the headmaster, the principal of the school can submit the report of the number of the school shops selling tobacco within 100 yards of the school, and the list can be provided to the SHO through directly or through the district level coordination committee, and then the SHOs can immediately take action, and the same report can be again given back to the school through the district level coordination committee. So and then in some states what they do is every SHO has a report which they submit every month, and in that monthly crime review report they also put CODPA violation as one of them. So that violation could very well be this violation for selling tobacco selling shops within 100 yards of the school. So in a way, we have already given you how it is to be done in many of the in the schools with the combined effort of both the education department, health department, and the ministry and the home department, which is the police department. So we would like to give you some of the evidences. When we have said some of the evidences, you can see the Tobacco-Free Educational Institute, the name of the teacher is there, the headmaster, then the contact person is also there. Then they have also given us the quick lines. And if you see some of them, the space is limited, or some of the schools, once you utilize the same poster for many issues which come to the school, like for the environment, the polythene-free institution, etc. So, and they do all this kind of system. So we need to have a monitoring system. How do we do this? So we are also trying to, in the ministry, trying to develop some monitoring mechanism or an online mechanism where the schools can report through the implementation of the topic. And in fact, the data that we have as of now, there are about 16 lakh education institutions and 23 crore school students. This is a big number which we can target within the next 3 years. We hope with the cooperation of all of us present here, as well as who have joined us join us from the district and the state authorities, we would be able to achieve 100% of the districts, 100% of the blocks, and at least 85% of the schools and 85% of the students. It's a huge number, and it is really, really going to impact tobacco control in the country. The roles have been identified, as I said during the presentation, that tobacco being an issue which is well beyond health, it needs to be done for this particular program with the cooperation of the education department and also the municipalities and other departments under which the schools come under, and the health department for leveraging the efforts of the education department and the police department, and then trying to implement it with willing partners in the form of civil societies or the NGOs. And as I said, within the department, the concerned departments, we need to have monitoring mechanism through digitally empowered mechanisms, and we need to share the operational data between and among the organizations, and then interdepartmental coordination. As I said, the best one which we have is the district level coordination committee or the state level coordination committee should be employed for monitoring the mechanism, monitoring the implementation. So how sustainable it is? If you integrate with the education department, the two systems can work together and evaluate together. And if you do not have this, then it cannot be just a health agenda, and it will be very difficult to implement. But if you have both the departments on board, it will be easy. Implementation would be easier, and the implementation manual of a trophy itself is enough. The trophy guidelines should be enough, but should you require any of these areas to be, simplified or modified better, please get back to us in the ministry. And we would also like to record some of the best practices and then train both the health and education department. And we have already supported this component in the state PIPs to the states, and I hope they will be utilizing this, and we are already monitoring this through various kinds of mechanisms for the trophy implementation in the country. The current status, it's a bit of June, is 50% of the states. Let me give you an idea how it was being implemented. They said that we have given the guidelines to the education department. So, but what happened after that, we need to know. And 50% of the states says that tobacco-free during 2029, 10 out of 437 schools. So only 10 of them. So don't you have the mechanism to monitor? Don't you have the mechanism to go there? Don't you have any other mechanism of making them tobacco-free with that scorecard? And then even when they declare few of the schools as tobacco-free, are they doing it as per the trophy scorecard or not? We need to know that. So some of the states also have high participations, like Andhra, which is about 22,000, and I know the number must have already risen by now. Then Karnataka about 42,000, and UP about 40,000 schools. So these numbers needs to increase so that we achieve 85% of the schools. So this is all I needed to share, and I hope the trophy implementation takes off in an accelerated mode, and that is going to have save thousands of lives, because many people, when they don't start young, they never become tobacco addicts, and the whole base of tobacco users is going to come down, and we would be heading towards a tobacco endgame for the country. Thank you very much for listening to me.
Thank you, sir, for presenting and sensitizing us on tobacco-free educational guidelines. Thanks a lot. And now I request our chair, Mr. Narendra Kumar, sir, to introduce our next speaker, Ms. Asuma, sir.
Thank you, Rajiv, and thank you, Dr. Swasti Charan. That was a great presentation. Now it's my pleasure to invite Ms. Ashima Sareen. She's the director of Sambandh Health Foundation. She's also the director of a very popular Voice of Tobacco Victims campaign, which built into a network of over 400 eminent doctors who are volunteering on tobacco control across India. This campaign won British Medical Journal Award in 2015. She has developed some new implementation models in tobacco control and has made noteworthy contribution to the development of tobacco control in India. She has led to the reduction, which has led to reduction in tobacco prevalence in the country. She has been part of advocacy campaigns leading to enactment of 2 national acts and 51 policy changes at the national and state levels. Qualified with MPhil in Public Health and Masters in Public Health from UK, MBA from Pune and MA in Sociology from Punjab University. She has over 15 years of experience in tobacco control. She is currently finishing her PhD in Public Health. She has been trained under Tobacco Control Leadership Program from Johns Hopkins University, Bloomberg School of Public Health in its first batch. She was also part of Tobacco Control Campaign in Action for Smoking and Health, ASH UK, London in 2011. So I'm pleased to invite Ms. Sareen to give her presentation, please.
Good afternoon, everyone. It's my pleasure to talk about the youth-based initiatives to prevent and reduce tobacco in young generations. Now, this issue is very close to my heart. You know, the reason is that my grandfather, both on my maternal and paternal side, both grandfathers, they died because of this tobacco. They both were smokers. And I wish if had we known all these strategies, probably would have saved and they would have been seeing me presenting here. Now, let's first look at what is that we are dealing with when we talk about youth. We have 5,500 children who start using tobacco every day. They initiate the tobacco use every day. And 90% of users, 90% users, they start in their teens. Only 3% of these will be able to quit. In fact, the global youth tobacco survey revealed that 8.5% of 13 to 15-year-old, they consume tobacco. Now we have 2 strategies. One, we chase those who are already addicts. And the second is that we stop them from starting it. So amongst these strategies, the best strategy, of course, is to stop the initiation. Now, this is what we met the Honorable President of India, and he said that we must focus on youth and we must make sure that, these youth have to participate in activities is how they are going to actually refrain from such deadly addictions. So we started, inspired from him, we started Pledge for Life, Tobacco-Free Youth campaign. That's how we, take pledge here. And under this banner, this campaign, we have done a lot of activities which focus youth. One of them is tobacco-free educational institutions. Now, let us understand first what is tobacco-free educational institutions. Ministry of Health and Family Welfare, Government of India issued revised guidelines that if a school has to declare themselves tobacco-free, you need to ensure that you have completed 11 activities which are anti-tobacco activities and scored 100 marks. It also set a goal that within 3 years, 85% of the schools must score 80 marks and 100% of the districts and blocks should be active. So these guidelines we are implementing at Sambandh Foundation. We is working in 3 states, that is Uttar Pradesh, Andhra Pradesh and Karnataka. Since June 2020, 1,71,000 schools have done 3,85,000 ground level activities in all these 3 states. Talking individually, in Uttar Pradesh, 76,000, that is 52% of schools have done 1,40,000 activities. In Andhra, 38,000 schools, 38,000, that is 62% schools have done 91,000 activities. And in Karnataka, 50,000 schools have done 131,000 activities. If you look at the Ministry of Health's target, it says 100% of the districts and blocks should be active. They have given, Ministry of Health has given every state a target that, we just discussed that 85% of schools must score 80 marks. All these three states are clearly depicting that the target ministry has set is achievable. Now, all these 171,000 schools in these three states, it covers the reach of this program of these schools which are active now is 6,26,501 teachers and more than 1.4 crore students. Now, this is a huge number. I think that it covers, I'm sure that when we increase the number of schools will become more active. We have 93%, 52% and more than 60%. In these three states, the reach is going to be it is going to be far more than what the numbers are here now. Now, it's important that any program must, success of the program is that we must be data driven. So for that, we need to have, what we did was that we started with a web-based application. We ensured there is an evidence-based reporting by the schools. So what this means is they upload the picture and upload it, they take the picture and upload it on this app. And we do online trainings and follow-up for entire monitoring and training these people to tell them what exactly needs to be done. Now, a very important challenge, I would say, we as tobacco control community have been facing a huge challenge that we are not able to stop tobacco sale near schools. In fact, COTPA and FCTC, both they ban these sales. Now, in toffee, there are a total of 11 activities, out of which activity number 9, it says that school has to report how many shops are there near their schools. So this up to since 2020, June 2020 till 31st August. In Andhra, 17,577 schools reported in activity 9. And of these, 17% reported that they have shops near their schools. Similarly, in Karnataka, 16,255 schools reported activity 9. 18% of these had shops. In Uttar Pradesh, 31% had shops out of 20,660, which reported activity number 9. So what did we do? We took this list wherein they had shops, 12,550 schools. We sent these lists to the district magistrates and the superintendents of police. Already, 49 out of 122 districts, the DMs, SPs have started taking action. They've confirmed it. You can see it in the news. It is already happening. So this is, what does it show actually to us? That this was a huge challenge. This model is making sure it's workable, and it is making sure that we can stop the sale near the schools. So it's a good model. It's a good thing which is working in front of us. So we definitely should be looking at such strategies. Now, so anything we have to, when we want decline, the answer is youth. We have to continue to focus on youth and stopping the initiation. That's the best strategy. Now, that's what brings me to the end of this presentation. And I am sure one day we will definitely have generation which will not use tobacco. So thank you so much.
Thank you, ma'am. Thank you for presenting on youth-based initiative to prevent and reduce tobacco among young generations. So to learn more about the topic, how to motivate your peer for tobacco. So we have with us our next speaker. So I request our chair, Ms. Upinder Preet Kaur Gill, to introduce our next speaker, Dr. Rakesh. Over to you, ma'am.
Thank you, Rajiv, and thank you, Ashima. I think that was a very insightful session that we had, and a lot of activities done by your organization, and we really look forward to more youth engagement. And again, I'm really, once again, very proud to introduce Dr. Rakesh Gupta. I think nobody else better than him can talk about this topic that we're going to discuss next. So Dr. Gupta, a WHO awardee, president, and has been working for tobacco cessation over a decade now, and has also developed a model on systems approach to tobacco cessation. He also represents India as a member of Asia Pacific Regional Network of Quitline since 2012, and has authored 2 subject-specific books in Hindi. So before Dr. Rakesh Gupta starts his session, and I think what Ashim also mentioned, and Dr. Rakesh would second me on that, that 88% of the first-time use of cigarettes happen before the age of 18 years. And I think youth is the most vulnerable population, the most vulnerable set of people wherein there's maximum impact of peer pressure around. So over to you, sir, looking forward to your insight and techniques as to how to motivate youth to save themselves from the peer pressure and to get into this habit of tobacco use. So over to you, sir.
Thanks, Upinder. Waiting for the recording. I thank the organizers for inviting me to present this session, and I wish to talk on how to motivate your peers for tobacco control under the session Galvanizing Youth for Tobacco Control. The agenda is to consider negatives for those who wish to use tobacco or who are already using it. And then we'll talk about the positives of being a non-user or a former user. We summarize the session by the takeaways, and then we'll have the interaction with the participants as per the permission of the chairs. So the negatives for those who wish to initiate tobacco use or who are already using it. One is, of course, the thrill and frill, easy to remember. That's why I have sort of paraphrased it. And tobacco use in a way is a misadventure, because you have already learned as to what harms tobacco causes from head to toe. So many people who use tobacco considering it as an adventure or as an experiment should think and remember that it's a misadventure for life. Imagine tobacco causing a loss of a parent earlier. This is not about you, but if somebody in your family is using tobacco, think about it that they are likely to lose 6 to 10 years of their lives if they do not quit tobacco much early in the life. So that is the big harm that one has to remember, that how will you manage yourself if one of the parents is missing from your life. Also, tobacco causes a loss of money. Your pocket gets a hole actually. You may even have to beg, borrow, or steal if you're not getting enough pocket money. So that's third point in negative part of tobacco use. The fourth thing is that the friend says sorry because you smell horrible when you are smoking, or you have dirty looks because of chewing tobacco. So it's important to remember that your looks matter. If your looks matter, I think you should not use tobacco at all. It is also very important to know that the family who loves you so much, if you are a tobacco user, they are hugely upset because they also know about the harms of tobacco. And they keep worrying even if you say that you are not using tobacco. So you have to assure them that is also a responsibility. But until you have become tobacco free, you must remember that you will not keep your family at rest and you will not be keeping them happy. Also remember that when you use tobacco, your peers or teachers scold or worst even, shun you, eventually avoid you. And if they avoid you, it's likely that you may get trapped in the bad company. You are no more a performer. Remember this. With tobacco use, this is a big problem, especially if you are a smoker. This tobacco smoke fills up your lungs, so you lose on stamina. You cannot perform the physical activities vigorously. And that's very important aspect. For chewer also, I consider you are no more a performer because your appearances are so dirty looking actually that people do not like to talk to you with your yellow teeth, the bad breath coming out of your mouth and the wrinkles on the face, etc. So it's important to remember that tobacco can harm you immensely socially. And also remember that somebody else is benefiting at your cost. Here it is tobacco industry. And tobacco industry often incentivizes the youth, particularly entices them and traps them in tobacco use by providing it free. But remember, nothing comes for free. And once you are trapped for life in a way, because if the addiction comes in very easily with nicotine, as you must have learned by now, it's important that do not take anything for free from tobacco industry specifically. What are the positives therefore when you say no to tobacco or quit it if you are a current user? Everybody knows, and you also must be knowing already, that health is wealth. It's important to remember in context of tobacco use particularly that you get affected from head to toe and your life shortens, your family is disappointed. So it's important that you take care of health, not only physical health, but mental health, the social, economical health, psychological health. All these matters a lot. It's not easy to say no. It's easy to say no to tobacco. Remember this. It's not difficult. Only thing you require courage and conviction, because tobacco is toxic, tobacco is poisonous, tobacco kills. Still better is to say that I will never use tobacco. Quitting benefits, we all know. Quitting benefits at every age, that is also an important. So quitting at an earliest is something which is required. Scientifically, it is proven early in the life, if you quit, you do not get the adverse effects of tobacco, your body recovers completely, and you are spared of the harmful effects of tobacco. Also remember that when we use tobacco or when we say no to it, all it is a mind game. You need to learn to control mind by saying no to tobacco. It is your choice what you want to do. And you can always make a choice to be tobacco free, a non-user of tobacco, and say no to tobacco. Many times quitting is not easy, but it is possible. Remember that. Many people quit. At least 60 to 70% are able to quit on the first attempt. And the longer term quit success is over 50%. Remember, after all, it's an addiction. It takes time. So it's good to say no to tobacco and yes to life. Tobacco-free life is the best life. The takeaways from this session can be, you can say oof to tobacco or its use is terrible. Remember harms beyond physical that makes the loved ones suffer. There are benefits of quitting. So quit as soon as possible. It far outweighs the short-term pleasures of its use, and choose a tobacco-free life. If you are a tobacco user, remember tobacco use is a disease and its user is a patient. So if you are a tobacco user, you are a patient. Demand treatment from your doctor. If he is unable to give it, go for the national quit line or mobile telephony service called M-Cessation, and you can get the facility online. I thank you very much for your kind attention and welcome your questions. Thanks a lot once again to all.
Thank you, sir, for making us understand and in very easier way. So thanks a lot. I hope the youth will benefit with your presentations. So finally, we move to our next section of this particular session, so question answer session. So I request all the speaker, please switch on your videos for responding your queries. And after this, we will invite all chairs to give their remarks on presentations. So now starting with our first questions from Dr. Sahana Egde. We have just compiled all the queries we have received through these chat and YouTube chat. So this question actually for Dr. Amit. So if sale within 100 yards of school is noted, does FDA and police act upon it? So it's maybe the questions to Amit. So Amit sir, can you just respond to this query of Dr. Sahana Egde?
Yeah, thank you, Dr. Sahana, for this question. Yes, they are listed as enforcement officer for section 6A and B, basically section 6. So they need to act upon it. They do in several of the jurisdictions, and primarily if there is a district nodal officer or if they already have a enforcement squad, they are part of these enforcement squad and they do comply with this enforcement. Thank you for the question.
Thank you, Amit sir, for giving a brief response to this query. So next query is from Grancharya from Odisha. So this question to Dr. Rakesh Gupta Jaipur. Main reason of teenager using tobacco, it's a psychological, yeah.
Okay, it's
social. Yes.
Good question, Gracharya. I think, am I audible?
Yes, sir, you are audible, sir. Yeah.
Okay. So we can say that both the reasons are responsible for the people using tobacco. Actually, you can also add eventually the third reason of being a physical reason, which tobacco use do give an alertness, or it causes a kind of relief in the tensions which one may have. But all these are in a way a wrong reason eventually. Teenagers use primarily because initially they want to experiment with tobacco use, but because of the nicotine, they get into the habit of using tobacco, because when they use tobacco, it brings about some physical change in their body and gives a sense of pleasure or alertness or relief of tension, as I said. And eventually they become addicted. So one must remember, as I told earlier in my presentation, that for short-term pleasures, do remember the long-term harm, that you will not be able to quit tobacco when you would like to quit it. It's a disease, and disease requires then the treatment. And many people don't feel that it's a disease. So there is a challenge, and then going to the hospital or calling on national quit line to quit tobacco, I think will be a additional task. It's easier to say no to tobacco. I will never use tobacco because it's toxin. It's a toxic product, or it is a poison. It kills. So remember that it's easy to say no, difficult to quit, and therefore remember the reasons and always avoid those. That is my plea. People do use tobacco because we have the studies which say that in 1/3 cases it's one of the parents or a relation or a sibling using tobacco, or people see in the films that the heroes and the villains, etc., who are doing some heroic works or some good or bad works, they use tobacco. That is why they use tobacco. And lastly, but most importantly, it's the peers. So peer influence can also bring about the tobacco use. So please understand, say no to tobacco. It's a better life. Tobacco-free life is the best life.
Thank you, sir. Thank you for motivating the youth for about the tobacco. So next question again from Dr. Sahana Egde to Dr. Amit. So Dr. Amit, Dr. Sahana wants to know about food containing tobacco. So which type of tobacco is like food containing tobacco? So can you just elaborate this? Dr. Amit.
Rajiv, yeah, thank you. I'm saying I can't see the question. Can you repeat it?
Yes. So this is a third question. So from Dr. Sahana Hegde, she wants to know about food containing tobacco. So I think you highlight one of the.
Yeah, food containing tobacco means the moment you. I was talking in the plenary also today about illicit tobacco. I think lot of gutka product which are packaged as plain pan masala, they contain tobacco. Today only we saw that there are a lot of in terms of these pan masala product which also contain nicotine. Today only there's a news item from Assam where Rajnigandha has been seized. And their company is asked not to produce any further because their pan masala contained nicotine and magnesium carbonate, sorry. So if you have any of your product which contains, any food product contains tobacco or nicotine, it is prohibited. One example of that is simply the water tobacco, Quibur from Mizoram and Northeast, I think Manipur and Mizoram. So, which means water is food. FSSA is regulating water in the country, and if anyone is putting tubur, which is tobacco, in water and packaging and selling it on the roadside in Mizoram, so then it is a food safety issue and it should not be allowed. Similarly, any kind of condiments and spices or any ingredient which are mixed with tobacco and sold is a violation of food safety. Having areca nut with sada, jarda, all of that is a violation of food safety. Any pan wala selling pan, the moment he mixes tobacco or jarda in that pan, he violates food safeties, or which says that you should not mix these two as ingredients. So I think that those are the examples, and I think food safety officers should take random checks of these spaces, these products, and prevent them.
Thank you, sir. Thank you for responding this query. So our next question is from one of the student, Ms. Akashi. So this question is to Ashima Sareen. So although knowing the effect of tobacco use, a major percentage of youth continue to use the tobacco product pertaining to their neglected and stern behavior. So how do we tackle with this behavior of the youth? So this question to Ashima, ma'am. Over to you, ma'am.
Thank you. So I think the tobacco-free educational institutions program, implementing this program will definitely help. But one important thing is the ownership of youth is the key. I'll just give you an example. We were working with the national NSS in Assam, and one of the students came up to us and said, ma'am, what happened? I told all my friends to quit. They were college students and they did not. So he said, I thought to myself that let me just tell their girlfriends that don't use tobacco. Don't meet them until they quit. So this is an innovative way. So youth is the key here. They come up with very innovative ideas and they can tell it better. But however, we have to make sure that this Ministry of Health program, the Tobacco-Free Education Institution program, must be implemented in all educational institutions. Be it schools, private colleges, or colleges, any educational institutions. So that's the key.
Thank you, ma'am, for responding to this question. So one question is to Dr. Swasti, sir, from Dr. Sahana Hegde. So if the center advised the district control cell to collaborate with the researchers from private colleges, so who are willing to do so, and tobacco control around, and it would go a long way. So I think it's a question to Dr. Swasti, sir. Sir, can you just respond to this? Yeah.
Rajiv, can you please repeat the question again? I missed part of it.
Yeah, sir, the question is, if the center advised the district control cell to collaborate with the researchers from various private colleges, so who are willing to do so? So tobacco control around, it would go a long way. So it may be a query, maybe a suggestions from Dr. Sahana Hegde. So can you just comment on that?
Yes, that's a very good question. That goes without saying. Our tobacco control program is going beyond health, and we want cooperation from every sector, and particularly the district Tobacco Control Cell has got a district coordination mechanism, which is known as DTCC, and that has got members from all sectors. And if not just research, but if at all it is research as well as implementation of the program, there are willing partners, we will be happy to incorporate all of them. And in this matter, we can issue directions to the districts and the states from the ministry. That's a very welcome step, and we are for it.
Thank you, sir. Thanks a lot. So next one question from Parul, again a student. So how should we increase a sense of responsibility to part of tobacco control among youth? So I think Dr. Rakesh Gupta from Jaipur can respond to this query.
Yeah, thank you, Parul. It's a good question again, and it's a phenomena which is called in psychology operant conditioning. Means for the short-term pleasure, you are avoiding or neglecting the long-term harms which can come. In tobacco, it applies very aptly because short-term pleasures of being in the company of peers or feeling elated with the use of tobacco, or maybe considering that you are getting an adulthood because you are using tobacco. Remember that tobacco is the toxic product. It causes the death of over 4,000 adult Indians every day. And it also causes an average loss of life by 6 to 10 years. So it's important to remember that come what may, tobacco-free life is a better life than using tobacco and getting sick eventually. Also, as I told you, there is an economic loss eventually, but also economic loss keeps occurring on a day-to-day basis. And one loses a lot while spending on tobacco use. So it's very important to stay free of tobacco use. I hope if this thing gets into the mind of the people, then you would consider twice or maybe more before getting into tobacco use. And as I said, it's a mind game. Remember, you have to develop a thought that tobacco is toxic, tobacco kills, and I will not use tobacco. If you have this thought in your mind, the thought of using tobacco will never enter into your mind. So remember, whenever you get into the thought, remember, just say that it's a thought which I have to stop. Stopping thoughts is not easy many times, but it can be done. And I think Trophy, therefore, the government of India's program of making the educational institutions tobacco free is a big initiative and influencer actually, which will help us a lot, because if the environments are tobacco free, we come to know the advantage of it. So my best compliments to the ministry, and I consider every student should ask in their school, demand the education institution to be tobacco free.
Thank you, sir. So our last question is to Dr. Poonam Khattar, ma'am. So Dr. Poonam, ma'am, it's a question related to GYTS. So GYTS 2019 found high prevalence among girls. Can we know the reason behind and how industry manipulates here? So any comment from your side, ma'am?
Yeah, thank you so much. I think some problem with my video, not able to, may not be able to see, but thank you so much for this question. And this is a very worrisome trend today. And, one very important thing which you have asked is how, the industry is regulating it. I think, if you have observed, we do have very specific film rules, whereby under each, whenever there is a rule, which depicts anyone smoking, a specific liner has to be there. But if we look at our OTT these days, they are so highly, depicting these scenes, and lots of young people, young women are shown in these, these scenes. Many times the scenes are made to fit the scene of smoking or use of drugs and other things. So I think it's very, very important that how we, really reach to these young girls, especially tell them about the health hazards, as I think previous speaker has mentioned about the wrinkles on the face, the bad breath. The girls are very, very specific, about their appearances. And also lots of stress of work these days also, many girls after 12th, I've observed, they are staying alone, and they have lots of deadlines to complete. And probably this is also one thing which they learn from their office colleagues, and to fit in that culture that yes, as a rebel, we are equal to you. In order to prove this, many of them take it up, And I think one reason maybe Dr. Rakesh Gupta from Rajasthan, really working on tobacco cessation would, feel, because I visualize many times, when it comes to cessation, we don't have many specific tobacco cessation programs for the young girls and the women, Imagine a young girl walking to tobacco cessation clinic, where all men and boys will be there. So sometimes just as we have antenatal clinics, or young girls for our adolescent specific behavior, specific centers for them, specific timings for young adolescents, maybe this also can be one of the reasons. So I think we really have to work on, depicting and telling the health hazards, not in a training program or not just in a, in addition to our TOEFL guidelines, we need to speak very, very specifically about the health hazards today. I feel, though they know, but maybe showing gory pictures, scary pictures, or having these rotation very often in our programs will go a long way. Thank you so much. I think I may have been able to address the question.
Thank you. Thank you, ma'am. So now I hand over to our chair to conclude our today's session. So starting from Mr. Narendra Kumar, sir.
Thank you, Rajiv. After these wonderful presentations, I just wish to make one point. In fact, that has already been said by Ashima, but I wish to underline that we need to make space as tobacco control community for our youth. They are the critical, as I said in the beginning, factors and actors in tobacco control. It might take a little more time to involve youth, and not just to involve them. I mean, they need to lead this entire movement. So that space creation and having that patience that they can do it is very important. And I think in that sense, this session, the symposium was wonderful, and I must congratulate the organizers for organizing this great discussion and underlining the importance of youth perspective in tobacco control. Thank you, Rai.
Thank you, sir. Thank you for your guidance. So now I request Upinder Preet Kaur Gill, our next chair, to give your closing remarks.
Thank you, Rajiv, and thank you all the speakers for such insightful sessions. And yes, as it has been mentioned in all the sessions also, and also by the fellow chairs, that youth have a lot of potential that we as tobacco control advocates need to identify and involve into our daily tobacco control activities. If we bring on board youth as leaders, so we as, the old ones in the game are going to learn a lot from these youth leaders, what the youth of today think. They can give a very fresh perspective, as Ashima mentioned, about, a very quick response as to how to, help those young boys think of quitting tobacco. So we would really learn a lot of new things from the youth perspective if we get more youth leaders attached to all of us. And I think we as a group need to identify, because all of us are working with the youth in one form or the others. But the more important role that now becomes when we as a country are talking about tobacco-free generation, we as a country are talking about eradicating tobacco completely from our systems. So we really need to bring the youth, the next generation, on the same page with us. And I think with that, it's going to make our lives easier when we talk about countering the emerging products. When we were fighting the menace of e-cigarettes, though our country has been very successfully, have been very successful in banning those. And now also, we are seeing a lot of threats coming in our way when we talk about, there are talks about regularizing and legalizing weed in the country. We have countries where they've already done that. So yes, I think the one take-home message from this session should be to identify in our respective areas those youth, those committed youth who can come forward and lead this tobacco control initiative and take it to the next level and also bring a lot of fresh ideas and insights into it. So thank you once again, and congratulations to the PGI team and to all the speakers for this very useful and insightful session.
Thank you, ma'am. So I now move to our last chair, Dr. Rakesh Gupta, sir, to giving the closing remarks.
So thank you, Rajiv. I think Narendraji and Upinder, they have summarized it well. So all the speakers, they did justice to the topic. The symposium has been, I think, very motivating and very informative. And I'll just particularly talk about Ashima. The Sambandh and BOTB, they have done real good job. So it's a big number, 171,000 schools covered and 385,000 ground level activities. That is massive. And they have almost covered 1.43 crore students. So I think this kind of ground level activity is required. And there's no doubt Dr. Rakesh Gupta, he has told so much about the peer pressure, how to deal with the peer pressure. Dr. Swasti Chandra has told about the toffee guidelines. Dr. Poonam Thakkar, she has very nicely told about the health effects of the tobacco. And Amit, he has told us about the tobacco laws, anti-tobacco laws, other than COTPA. So especially the Consumer Protection Act 2019, actually, many would not be aware that that can also be used. So thanks a lot, Rajiv, and thanks a lot all the panelists. Thank you.
Thank you, sir. So if any speaker wants to add anything in last minutes, so I think I have seen Dr. Swasti sir is here. So any last comments, sir, from your side?
Thank you, Rajiv. I think we had a very nice interaction on all spheres of protecting the youth from the ill effects of tobacco, so that they do not initiate ideally. And if they have initiated for some wrong reason, we should be able to provide them every opportunity to quit. So this is a comprehensive whole range of activities that we have explained, and I think we have known the reasons for saying no to it. I sincerely urge all the students who are joined with us somehow virtually to say no to tobacco. This is good for all of us. Thank you so much.
Thank you, sir. Thank you for always guiding us from the top level. Thank you. Ashima Serene ma'am, if you want to add anything, any last comment? Yeah.
I think it's a fantastic session. And in fact, Dr. Rakesh Gupta also pointed out that cessation is important. And in our webinars, which we've been training teachers and principals, they come up with one question very promptly. He was there in one of the sessions, when one of the webinars, they say that we want to quit. So how do we deal with that? And I don't think so far we have something, the quit lines or any other cessation centers where students are coming for getting counseling, to get counseled. So that is something which we need to deal with. We need to make sure that that is a population which also needs to be dealt with. So thank you so much. And I must say, Pledge for Life, this is a youth session. We must say that, tobacco-free youth is what we are looking at.
Thank you, Sari ma'am. So any last comment from Dr. Amit, Dr. Poonam ma'am?
Thank you so much. I think all the chairs have given us, lots of directions also have come up from these speakers. And it's a great challenge, I think, to communicate health hazards. I've been really thinking that it's time we have had some new videos, some new, communication messages must be there, even though with respect to COVID, we have started to add 1 or 2 liners, but it's time that we create some more communication messages and strategies specifically for the youth, starting from 6-7 years onwards, primary schools, secondary schools, and senior secondary schools. This is required. I feel it's a gap today.
Thank you, ma'am. Thank you. So I want to thank our chair now, Mr. Narendra Kumar Singh sir, and Dr. Rakesh Gupta Saifa, and Ms. Upinder Preet Kaur ma'am for chairing the session. And also thanks to all the speakers for giving this very informative knowledge through our youth and our audience of the conference. Thank you for having with us today. As we have already crossed the limit of
Rajiv,
time.
I just give
Yes,
me
yes,
30
yes.
seconds.
Yes, sir, Amit sir, please. Go ahead.
As I think the stalwarts are here, and even the Ashima, who is working very in terms of in the front line for toffee guidelines, and Dr. Swasti Charan is leading that from the Ministry of Health. One thing that I just want to reiterate that, and I think we must realize, and that's where the whole my discussion on tobacco control law and other laws is, that we must understand that access of tobacco to a minor is an illegal activity. That also needs to be reiterated. And that is where enforcement is also a very important component of compliance with toffee guidelines or compliance with COTPA. So if we tell people that it's fine that tobacco is not an illegal product, but selling tobacco or having access of that product to a minor is an illegal activity. So I think that needs to be reiterated, and I hope that in our deliberations, in our interactions, and in our webinars and other places, we will reiterate that enforcement is particularly important when we want to protect minors from exposure to tobacco. Yeah. Thank you so much.
Thank you, sir. Thank you for your deliberation on this topic. Thank you. So thank you all. Thank you all the chairs and speaker for having with us. Thanks a lot. So now I request our audience to go for poll questions. So poll is in the bottom of the screen, QA session. So you just click on QA sessions and see in the button of poll. So first question is, smoking is completely banned in many public places and workplace such as healthcare, educational and government facility, on public transports. So do respond to this query. Excellent. So many people just mentioned yes. So now we move to our next questions. The sale of tobacco product is prohibited by vending machines, within how many yards of any educational institute? 100 yards. Great. So moving to our next questions. Which strategy is the best to prevent youth from initiating tobacco use? So here is the options. Good. So next question is, increasing price of tobacco product would be decreased tobacco use among youth, shift cheaper tobacco products, and no impact at all. Good, the option A. So our last question is, how would you rate this session? Fair, good, very good, excellent, and exceptional. Excellent and exceptional. Great. Thank you all the audience for participating in all the poll questions. So I think we have few announcements. So as we have already mentioned, all the benefits to the delegate in their email package. So please go through and participate various competition, resource material, live chat, networking launch, and also download your e-certificate maybe in closing time of third day. Help desk is here. Publication of abstracts is here. And receive an e-copy of conference seminar, which will contain all scientific proceeding and glimpses of the event. Visit and explore the e-exhibition area of the portal, and also e-poster display area. Immediately after these sessions, the e-poster display area will be telecast, because already all the speaker here at the lunch break. So query to the present, you can ask your queries to the present. You can tag the name of the presenter with their query in the chat box of e-poster area. E-poster presenter, please note that you need to present between this time, because we have already initiated a e-poster display query session. And next is, yes, we are also planning to have a social media Twitter break in the afternoon time. So please be there around 4 p.m. to 4:30 p.m. And along with this, we have various competitions is ongoing competition during this conference. So you can also participate in a social media contest, just a minute session, and meme competition, a jingle on tobacco control, and slogan writing. So you can also pitch in and do your participation in these competitions. And also there is a feature of this 3D portal hall. You can access the exhibition hall and interact with the sponsors. So there is a sponsored, and few of the pharma sponsors also providing the sample of their product to the audience. So this is all the exhibition area. So we have many corporate sponsors and the social sponsored here. Great. So again, this last announcement, we have scheduled a tobacco carnivals, a cultural program on day 2 today around 6:30 to 7:30 p.m. in Hall A. So please be there for this special event also. So thank you all. Thanks a lot for joining us today. Thanks.